Most people think high blood pressure announces itself loudly. In real life, it often does the opposite. It stays quiet, and that silence is part of the danger. I'm Catherine Blake, and in this video, I want to walk you through something I wish more people understood before they ever hear the words, "Your blood pressure is high." I'm going to speak to you the way I would speak to a patient in a calm exam room, clearly, honestly, and without trying to scare you. Here is the hidden truth. High blood pressure usually does not give you one big dramatic signal. What it does sometimes is leave a trail of body clues that people brush off as stress, age, poor sleep, or just one of those days. And by the time many people get a formal diagnosis, that quiet pressure has already been wearing on the blood vessels, the eyes, the heart, the brain, and the kidneys. The only way to know for sure is to check your blood pressure, because hypertension often has no symptoms at all. But there are still warning patterns that deserve attention, especially when they repeat. Think about someone like Daniel. He is 46, works long hours, drinks too much coffee, sleeps lightly, and tells himself he is just tired because life is busy. He starts waking up with pressure in his head some mornings. He notices that climbing stairs leaves him a little more winded. Once in a while, he gets a nosebleed and blames dry air. He puts off a checkup because nothing feels serious enough to justify it. Then, one afternoon, at a pharmacy machine, he sees numbers he did not expect. Suddenly, all those small things look very different. That kind of story is common, not because every headache or nosebleed means hypertension, but because people are very good at normalizing gradual change. The body whispers long before it screams. So today, I'm going to show you 9 warning signs and body clues that can show up before a diagnosis of high blood pressure. I'll tell you what people usually assume each sign means, what it may actually signal, what may be happening inside the body, and one simple habit that can help. We're going to move from the easiest clue to miss, all the way to the signs that should never be ignored. And the first one is the most important, because it catches almost everyone off guard. 1. Feeling completely normal. What people think it is, good news. No symptoms means no problem. What it actually may be, the classic pattern of high blood pressure. This is the part many people do not like hearing, but it is the truth. The first warning sign of high blood pressure is often the absence of warning signs. That sounds strange, but it matters because it is exactly why so many cases go undiagnosed. A person can look well, work, exercise, laugh, travel, and carry on with everyday life while their blood pressure stays too high in the background. CDC, NHS, and WHO all make the same core point. High blood pressure usually has no obvious symptoms, and the only way to know is to measure it. What's happening in the body is not magic. Think of your blood vessels like a long system of flexible garden hoses. Blood needs to move through them at the right pressure. When the pressure stays too high, the inner lining of those vessels takes small, repeated hits. You do not feel those hits the way you feel a cut on your skin. They happen quietly. Over time, that strain can stiffen vessel walls and raise the risk of damage in places that need delicate blood flow, especially the brain, eyes, heart, and kidneys. A simple analogy helps here. Imagine driving a car with tires that are always overinflated. The car still moves. It may even seem fine for a while. But the wear is building, mile after mile, and you do not notice it until a weak point shows itself. High blood pressure works like that. It is often a wear and tear problem before it becomes a symptom problem. Light scientific support is enough here. Blood pressure at or above 130/80 is considered high by CDC, and persistent elevation over time is what raises risk. It is not about one emotional moment or one bad meeting. It is about what stays elevated when life goes back to normal. Practical habit or fix. Stop waiting for symptoms to prove you need a reading. Check your blood pressure at home, at a pharmacy, or at a clinic, and write the numbers down. If you are over 40, have a family history, carry extra weight, sleep poorly, smoke, drink heavily, or live under constant stress, make blood pressure checks part of normal life, not emergency life. That one habit catches more hidden hypertension than any symptom ever will. And now that we've started with the silent clue, the next one is a body signal people dismiss all the time. 2. Morning headaches that keep coming back. What people think it is: poor sleep, too much screen time, dehydration, stress, or sleeping in the wrong position. What it actually may be: a signal that blood pressure is running high, especially when headaches are frequent, feel like pressure, or show up early in the day. To be clear, most headaches are not caused by high blood pressure. Headaches have many common causes, but official health sources do list headaches as one of the symptoms that can happen with very high blood pressure, and repeated pressure-like headaches should not be brushed aside when they come with other clues or risk factors. NHS lists headaches among the symptoms that can sometimes happen, and Mayo Clinic notes that some people with high blood pressure may have headaches, though they are not specific and often show up when blood pressure is already quite high. What's happening in the body? Think of the blood vessels in your head like very fine plumbing inside a sensitive room. The brain itself does not like pressure changes. When blood pressure climbs or stays elevated, the vessels that support the brain and surrounding structures may react. That does not mean every headache is vascular, but it does mean that recurring head pressure can be one clue in the full picture. The analogy I use with patients is this. Imagine turning the water pressure up in a house with delicate older pipes. The first thing you may notice is not a burst pipe. You may hear rattling, vibration, or subtle strain before there is obvious damage. A repeated morning headache can be like that rattle. It is not the final event. It is a signal worth checking. Light scientific support matters because this is where confusion spreads online. Headaches are not a reliable standalone test for high blood pressure. That is the key point. But they can happen, especially when blood pressure is very high, and that is why you should pay attention to pattern, not panic over one episode. Practical habit or fix. If you are waking with headaches several times a week, do not just reach for pain relief and move on. Check your blood pressure at different times of day for several days. Also, look at salt intake, alcohol, sleep quality, and whether you may have sleep apnea. Good sleep, less alcohol, regular movement, and lower sodium are not glamorous solutions, but they work because they remove pressure from the system, rather than just covering the signal. CDC recommends physical activity, healthy weight, limiting alcohol, not smoking, and healthy sleep as part of prevention. But this is where it gets more serious, because the next sign points to one of the organs high blood pressure can damage early. 3. Blurred vision or visual changes. What people think it is: eye strain, age, needing stronger glasses, or too much phone use. What it actually may be: pressure-related strain on the tiny blood vessels in the eyes. The eyes are one of the few places in the body where small blood vessels can show the effects of pressure fairly directly. When blood pressure stays high, those delicate vessels can narrow, leak, or become damaged over time. That is one reason vision changes matter so much. NHS lists blurred vision as a symptom that can happen with high blood pressure, and the American Heart Association includes change in vision as a warning sign in severe hypertension and hypertensive emergency. Think of the blood supply to the eye like a camera sensor that depends on a clean, stable power source. If the wiring is erratic or overloaded, the image quality suffers. Your eyes need steady circulation the way a camera needs stable electricity. Too much pressure in those tiny vessels can interfere with that clarity. Another way to picture it: if your blood vessels are like roads, the vessels in the eye are narrow side streets, not big highways. They are efficient, but they are not built to handle long-term extra strain without consequences. High pressure in the system tends to show up first in the smaller, more delicate routes. Light scientific support here is strong and consistent. CDC specifically notes that high blood pressure can cause problems for the eyes, even when it causes no noticeable symptoms early on. So if you are having repeated episodes of blurred vision, double vision, or sudden visual changes, do not assume it is simply fatigue. Practical habit or fix. Take repeated visual changes seriously, especially if they come with headaches, dizziness, chest discomfort, or high readings on a home monitor. Reduce the load on your blood vessels by cutting sodium, checking labels on processed foods, and building meals around the DASH eating pattern. DASH is specifically designed to help lower blood pressure and emphasizes fruits, vegetables, whole grains, and lower sodium intake. NHLBI notes that lowering sodium to 1,500 milligrams a day can lower blood pressure even further than 2,300 milligrams. If this is making sense so far, type yes in the comments. Not for me, for you. It is a simple way to pause for a moment and notice whether any of these patterns sound familiar in your own life. Now, we move from the eyes to the heart and lungs, because the next clue often shows up during ordinary daily activity. 4. Shortness of breath doing simple things. What people think it is: getting older, being out of shape, gaining a little weight, or having a busy week. What it actually may be: your heart working against too much resistance. This sign is easy to misread because it can creep in slowly. A person starts noticing that stairs feel harder, carrying groceries feels heavier, walking uphill feels less comfortable than it used to. They tell themselves they just need to exercise more. Sometimes that is true, but sometimes high blood pressure is part of the reason, because the heart is pumping against a system that is under too much pressure. Mayo Clinic lists shortness of breath among symptoms that may occur with high blood pressure, and the American Heart Association includes it as an emergency warning sign when blood pressure is extremely high. What's happening in the body? Think of your heart as a delivery pump and your blood vessels as the delivery routes. If the routes become tight and resistant, the pump has to push harder to move the same amount of blood. Over time, that extra workload can make the heart less efficient. When the heart has to strain, activity that used to feel easy can suddenly feel more expensive, like carrying a heavy backpack without realizing someone added bricks to it. I often explain it this way. Imagine trying to blow air through a narrow straw. You can do it, but it takes more effort than blowing through an open tube. High blood pressure makes circulation feel more like the straw than the open tube. The heart can compensate for a long time, but not without cost. Light scientific support helps keep this grounded. Shortness of breath is not specific to hypertension. It can also happen with lung disease, anemia, anxiety, infection, or heart disease from other causes. But in the setting of repeated high readings, family history, swelling, or chest pressure, it becomes much more meaningful. And if it appears suddenly or severely, especially with chest pain, that becomes urgent. Practical habit or fix. Do not just accept declining tolerance as normal aging. Start walking regularly if your doctor says it is safe, because consistent moderate exercise can help lower blood pressure and improve how efficiently the heart works. CDC recommends at least 150 minutes a week of moderate intensity activity for adults. Also, check your blood pressure before you assume the problem is only fitness. The next one is where many people get caught off guard because they assume it must always be a separate issue. 5. Chest tightness, pressure, or chest pain that comes and goes. What people think it is: heartburn, anxiety, poor posture, or stress. What it actually may be: the heart asking for attention. Chest pain is one of those symptoms people either overreact to or underreact to. The more dangerous mistake is usually the second one. NHS says to get urgent help if you have chest pain that comes and goes and think it could be linked to high blood pressure. The American Heart Association is even clearer. Chest pain with a blood pressure above 180/120 can be part of a hypertensive emergency and needs emergency care. Here is the body explanation in simple terms. Your heart is a muscle. Muscles need oxygen-rich blood. If blood pressure is high over time, it increases the workload on the heart and can contribute to damage in the arteries that feed it. That means the heart may be forced to work harder while the supply lines are under strain. When demand rises and supply is not keeping up well, the chest may feel tight, heavy, or uncomfortable. Think of it like a water pump that has to push uphill all day. The motor gets hotter. The strain builds. At first, the machine still works, but it starts making noises you should not ignore. Chest pressure is one of those noises. Light scientific support again. Not all chest pain is caused by hypertension, but high blood pressure is a major risk factor for heart disease and stroke. That is why chest symptoms in this setting deserve respect, not self-diagnosis. CDC notes that high blood pressure raises the risk of heart disease and stroke, and NHS and AHA both flag chest pain as an important symptom to act on. Practical habit or fix. If chest pain is severe, new, or paired with shortness of breath, weakness, speech trouble, or a very high reading, seek urgent or emergency care. Outside of emergencies, reduce the everyday load on your cardiovascular system by lowering sodium and eating in a more structured way. DASH is one of the most practical tools here because it does not ask for perfection. It asks for better building materials for the system. And the next sign is one people usually explain away in a single sentence. My nose just gets dry. 6. Nosebleeds that are more frequent than usual. What people think it is: dry air, allergies, picking the nose, or winter weather. What it actually may be: sometimes just that. But repeated or unusual nosebleeds can also be a clue when blood pressure is high. This sign needs a balanced explanation because there is a lot of confusion around it. Many nosebleeds are not caused by high blood pressure. Dry nasal passages are very common, especially in dry environments. Mayo Clinic Health System notes that nosebleeds in general are not usually a symptom of high blood pressure. At the same time, NHS, Mayo Clinic, and other reputable sources list nosebleeds among symptoms that can occur in some people with very high blood pressure. So the right way to think about this is not nosebleeds equal hypertension. It is repeated nosebleeds belong in the overall picture, especially if other signs are present. What's happening in the body? The nose contains tiny, fragile vessels close to the surface. Think of them like thin threads near the top layer of fabric. They do not need much irritation to bleed. Dry air can do it. Infection can do it. But if the pressure inside the overall system is running high, those fragile points may be less forgiving. An analogy helps here. Imagine a very delicate balloon tied onto a larger pressurized system. If the system pressure rises, the weakest, thinnest part is more likely to show stress first. That does not prove the balloon caused the pressure problem. It only tells you where strain became visible. Light scientific support matters because context matters. If you get one mild nosebleed in winter, that is not the same as frequent nosebleeds plus headaches, blurred vision, or high home readings. Patterns matter more than isolated events. Practical habit or fix. First, treat the common causes too. Use a humidifier if your air is dry. Keep the lining of the nose moist. But if nosebleeds are becoming regular, stop treating them like random weather events. Check your blood pressure. Review your alcohol intake. Review your salt intake. Look at whether you are using decongestants often, because those can raise blood pressure in some people. Let the pattern guide you. And if you are also getting headaches, visual changes, chest symptoms, or high readings, seek medical advice promptly. Now we come to a clue that often feels vague and easy to dismiss, but it tells us something important about circulation. 7. Dizziness, feeling off balance, or mental fog. What people think it is: standing up too fast, skipping lunch, stress, not enough water, or being tired. What it actually may be: a circulation signal that deserves attention, especially when it keeps happening. Dizziness is tricky because it has many causes. Sometimes it has nothing to do with blood pressure. In fact, low blood pressure often causes dizziness more clearly than high blood pressure does. But severe high blood pressure can also come with dizziness, confusion, or a general sense that something feels off, especially when the brain is not getting the stable environment it needs. Some emergency guidance around very high blood pressure includes neurologic symptoms such as confusion, weakness, numbness, and trouble speaking. What's happening in the body? Your brain is like a control room that depends on steady fuel and stable wiring. It does not do well with extremes. When blood pressure is chronically high, vessel health can suffer. When blood pressure spikes severely, the brain may react because the circulation environment is no longer stable. That reaction may feel like dizziness, unsteadiness, poor focus, or a strange pressure in the head. I tell patients to picture the brain like a very sensitive computer plugged into a power supply. If the voltage is too low, the system flickers. If the voltage is too high, the system also suffers. Either way, the control room does not like unstable input. That is why repeated dizziness should not be automatically filed under, "I'm just tired." Light scientific support. Dizziness is not a diagnostic sign of routine hypertension, but in the presence of very high readings or other warning signs, it becomes more important. The danger is not in one dizzy moment after standing up. The danger is in a repeated pattern that a person normalizes for months. Practical habit or fix. When you feel dizzy or foggy, do not just sit there guessing. Measure something. Check your blood pressure if you can. Notice whether you also feel short of breath, have chest pressure, or notice visual changes. Create a small symptom log. Date, time, what you felt, and what your reading was. This turns a vague feeling into usable information for you and your doctor. And this is where the stakes rise again, because the next sign involves the rhythm of the whole system. 8. A pounding pulse, palpitations, or feeling your heartbeat too strongly. What people think it is, anxiety, too much caffeine, not enough sleep, or a stressful day. What it actually may be, your body reacting to a system under strain. Many people describe this as, "I can feel my heartbeat in my chest," or "My pulse feels louder than usual," or "My heart seems to pound in my head when I lie down." Again, this does not automatically mean high blood pressure. Caffeine, stress, some medications, and rhythm problems can all cause palpitations. But when the cardiovascular system is under pressure, it is not unusual for people to become more aware of the force of circulation. What's happening in the body? Think of your circulatory system like a set of roads with constant traffic. If the roads narrow and the pressure rises, the movement of traffic feels more forceful. The heart may pump harder, the vessels may be less relaxed, and the sensation becomes more noticeable to you. You are not imagining it. You are feeling a system that is less calm. Another analogy. A quiet washing machine is one sign that the load is balanced. When it starts shaking and thumping, the machine is telling you something about the load inside. A pounding pulse can be like that thump. It is not always dangerous, but it is information. Light scientific support here is more about mechanism and risk than a perfect symptom checklist. High blood pressure raises cardiovascular strain, and lifestyle factors that push blood pressure up, such as excess alcohol, smoking, poor sleep, and inactivity, can also make palpitations more noticeable. CDC guidance on preventing and managing high blood pressure strongly emphasizes activity, healthy weight, not smoking, and limiting alcohol because those habits affect the system as a whole. Practical habit or fix. First, remove easy triggers. Cut back on stimulant overload. Watch how much caffeine and alcohol you use, especially late in the day. Prioritize sleep. And check your blood pressure when the pounding feeling happens. One supplement that may support blood pressure gently alongside lifestyle changes is magnesium, especially if your diet is low in magnesium-rich foods. The NIH Office of Dietary Supplements notes that adequate magnesium intake may reduce the risk of high blood pressure, and consumer guidance notes that magnesium supplements might decrease blood pressure by a small amount. It is support, not a cure, and you should consult a doctor before using it, especially if you have kidney disease or take regular medications. We're almost to the 2 signs that should stop people from minimizing what they feel. The next one often shows up quietly in the lower body. 9. Shortness of breath with swelling, or a sudden sense that your body is retaining fluid. What people think it is, eating salty food, sitting too long, hot weather, or my socks always leave marks. What it actually may be, a clue that the heart and kidneys are feeling the load of pressure. This sign is less talked about in simple videos, but it matters. High blood pressure can affect the heart and kidneys over time. When those organs are under strain, fluid handling in the body can become less efficient. You may notice tighter shoes, ankle swelling, puffiness, or getting more breathless than makes sense for the activity. CDC specifically notes that high blood pressure can cause problems for the kidneys and heart, even though it usually causes no symptoms early on. What's happening in the body? Think of the kidneys as highly skilled filters, and the heart as the main pump feeding those filters. If the pressure system stays too high, both the pump and the filters can start losing efficiency. The result is like a building, where the plumbing pressure is wrong and the drains are struggling. Water starts collecting in places it should not. The analogy I use is simple. Your body is a house with a pump, filters, and pipes. If the pump works too hard for too long and the filters are stressed, water management becomes messy. You start seeing signs at the edges first. Light scientific support. Swelling alone is not a reliable sign of hypertension, and it can happen for many reasons. But when fluid retention appears along with fatigue, breathlessness, high readings, or chest symptoms, it becomes part of a meaningful pattern. This is especially important for people with diabetes, kidney disease, or known heart risk. Practical habit or fix, take a hard look at sodium. Most people think of salt as only what they shake onto food. In reality, much of the sodium load comes from packaged, processed, and restaurant foods. Dash helps because it lowers sodium and improves the balance of potassium, calcium, magnesium, fiber, and protein. Another supplement that may support blood pressure modestly alongside diet and exercise is omega-3, often from fish oil. Evidence summarized by the American Heart Association and Mayo Clinic suggests omega-3 intake can produce modest blood pressure reductions in some people. Again, support only, not a solution, and consult your doctor before use, especially if you take blood thinners or other medications. And now we come to the final warning sign. This is no longer a quiet clue. This is the body saying the pressure problem may be crossing into emergency territory. 10. Numbness, weakness, trouble speaking, or sudden major visual change. What people think it is, maybe I just need to rest, maybe it will pass, maybe I should wait and see. What it actually is, a medical emergency until proven otherwise. If your blood pressure is above 180, over 120, and you have chest pain, shortness of breath, back pain, numbness, weakness, change in vision, or difficulty speaking, the American Heart Association says to call emergency services. Mayo Clinic gives the same message for blood pressure at or above 180 over 120, with chest pain, shortness of breath, or symptoms of stroke. These are not watch and wait symptoms. What's happening in the body? At this stage, the concern is not just that the pressure is high. The concern is that high pressure may be causing acute damage to organs that cannot tolerate it, especially the brain. Stroke symptoms happen because part of the brain is not getting the blood flow or oxygen it needs, or because a vessel has been damaged. Mayo Clinic notes that blood vessels damaged by high blood pressure can narrow, break, or leak, and that high blood pressure raises stroke risk. Think of the brain like the control center of a city. If the power lines fail in one area, parts of the city go dark immediately. Speech changes, one-sided weakness, numbness, trouble walking, and sudden visual change are like neighborhoods losing power. You do not debate with that. You respond to it. Light scientific support is straightforward here because the recommendations are very clear. Severe hypertension with neurologic symptoms is an emergency. This is not the time to search forums, drink water, nap, or wait for morning. Practical habit or fix. Know your personal action line before you need it. If a home monitor shows a reading over 180 over 120, wait a minute, check again. And if it is still that high with symptoms, get emergency help. Share this rule with family members, especially older relatives who tend to minimize symptoms. The emergency plan is part of prevention because it shortens dangerous delay. Now, let me pull all of this together, because there is one big idea I want to leave with you. High blood pressure is often called a silent condition for a reason. The biggest trap is waiting for a loud symptom. The body may show clues before a diagnosis, but the clues are often subtle, inconsistent, and easy to explain away. That is why this topic matters so much. The real mistake is not missing one perfect sign. The real mistake is ignoring a repeating pattern. If you look back at the signs we covered, there is a clear progression. At the mild end, you may simply feel normal. That is the first reason hypertension hides so well. Then come the softer clues people dismiss. Recurring morning headaches, blurred vision, getting more winded, doing ordinary things, a pulse that feels stronger than usual, a nosebleed pattern that is more frequent than normal, spells of dizziness or fogginess, or subtle fluid retention and breathlessness. And then, at the serious end, the red flag symptoms show up. Chest pain, severe shortness of breath, major visual change, weakness, numbness, or trouble speaking. Those are not messages to interpret. They are messages to act on. Here is the personal responsibility shift I want for you. Do not think, I'll deal with blood pressure when I feel bad. Think, I know this can stay hidden, so I will check before it has a chance to do damage. That is a very different mindset. It is calmer, smarter, and much more protective. Now you know what your body may be showing long before a formal diagnosis. You know that the first sign may be no sign at all. You know that recurring headaches, blurred vision, chest discomfort, shortness of breath, frequent nosebleeds, dizziness, pounding pulse, fluid retention, and neurologic symptoms each deserve context, not denial. And you know that blood pressure is not just a number on a machine. It is a measure of how much force your entire vessel system is living under, hour after hour, day after day. So here is your immediate action step. Within the next week, check your blood pressure properly and write the readings down. Sit quietly. Use the cuff correctly. Take more than one reading on different days. If your readings are high, do not argue with the number. Bring it to your doctor. At the same time, make one pressure-lowering change that you can actually keep. Walk most days, reduce processed foods, lower sodium, limit alcohol, sleep more consistently, or stop smoking. Small changes done steadily are far more powerful than dramatic changes done for 3 days. And one final reminder, because it is worth repeating carefully, supplements are not substitutes for diagnosis or treatment. Magnesium may support blood pressure modestly in some people, and omega-3 may also help a little alongside diet and exercise, but neither replaces proper measurement, medical advice, or medication when medication is needed. If this video helped you see high blood pressure in a clearer, calmer way, subscribe for more evidence-based health education. Leave a comment with the word yes if you're going to check your blood pressure this week. And share this with someone who always says, I feel fine, so I'm probably fine.